Can a home sleep test really diagnose sleep apnea? Yes. For the right patient, it can be very helpful.
But no, it is not the best first test for everyone.
Today, I'll explain what a home sleep apnea test, or HSAT, does well, who should use it, and when a full sleep lab study is the better choice. A home sleep apnea test is a simplified sleep study done in your own bed. It usually measures airflow, breathing effort, oxygen level, and heart rate. It is mainly designed to look for obstructive sleep apnea, where the airway repeatedly narrows or collapses during sleep. The American Academy of Sleep Medicine says HSAT can be used as an alternative to lab testing in uncomplicated adults who have symptoms suggesting a high risk of moderate to severe obstructive sleep apnea. HSAT is quite effective when the patient is carefully selected. It works best when the story strongly fits obstructive sleep apnea, for example, loud snoring, witness pauses in breathing, obesity, large neck, and daytime sleepiness. But HSAT has a limitation. It records fewer signals than a full lab study, so it can miss milder disease or give a falsely reassuring result if the test quality is poor. That is why a negative home test does not always rule out sleep apnea. In fact, ASM guidance says that if one home test is negative, inconclusive, or technically inadequate, the next step should be an in-lab polysomnogram. No, HSAT should not be the first test for all patients. It should also not be used as general screening for people without symptoms. HSAT is best for adults with uncomplicated suspected obstructive sleep apnea. A full sleep lab study is usually better if the patient has significant heart failure, serious lung disease, suspected central sleep apnea, possible narcolepsy, parasomnias, or periodic limb movement disorder, neuromuscular disease, chronic opioid use, or concern for sleep-related hypoventilation. The 2017 AASM diagnostic guidelines specifically recommends polysomnography rather than HSAT in adults with significant cardiorespiratory disease, neuromuscular weakness, awake hypoventilation, or suspected sleep-related hypoventilation, chronic opioid use, prior stroke, or severe insomnia. Here are the big advantages of home testing. Number 1, convenience. You sleep in your own bed. Number 2, lower cost. It is usually less expensive than a lab study. Number 3, faster access. It may reduce delays in diagnosis. Number 4, more natural sleep setting. Some patients sleep better at home than in a sleep lab. Now the disadvantages: it collects less data than a full polysomnogram. It does not usually measure brain waves, so it cannot tell exactly when you are asleep versus awake. That means it may underestimate severity. It can also miss other sleep disorders, and if the sensors come loose, the test may be inconclusive or inaccurate. So HSAT is a very useful tool, but it is not the gold standard for every patient. Here is the bottom line. A home sleep apnea test is a good first option for many adults with a high chance of uncomplicated obstructive sleep apnea. But it should not be used for everyone, and a negative home test does not always end the story. The right approach is simple: the right test for the right patient, interpreted by the right clinician. If you snore loudly, stop breathing during sleep, or feel tired all day, talk to your doctor about sleep apnea evaluation. And follow Dr. PK for more simple, practical medical education. Stay informed, stay healthy.